cover the actions of muscles, particularly the muscles that make up the rotator cuffs. First, we will look at how muscle actions work. Muscles can be found all around our body. They have striations, which means that the fibers that compose muscles are grouped into strands going in a particular direction. Muscles can only contract, or shorten, as part of their action, and they can only contract in the direction of their striations. For example, if a muscle has striations that run vertically, then when that muscle contracts, it will be responsible for moving in an inferior or superior direction. It would not be able to move anteriorly to posteriorly or medially to laterally, for example. Therefore, to predict muscle actions, you must look at the direction of the striations and determine which type of action would cause that muscle to contract, which means it would decrease the distance between the attachment points. Today we will discuss the rotator cuffs. The rotator cuff consists of 4 muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles each connect to the humerus and the scapula. The first one we will examine is the supraspinatus muscle. We will look at this from a posterior view of the skeleton. Its medial attachment point is the supraspinous fossa of the scapula, which correlates to the muscle's name. Its lateral attachment point is the greater tubercle of the humerus. As you can see, the striations run horizontally. This means that the action of this muscle is abduction of the shoulder joint, which means the arm is moving away from the body. Posterior to the supraspinatus is the infraspinatus. Supra means above, while infra means below. The medial attachment point is the infraspinous fossa of the scapula, and its lateral attachment point is also the greater tubercle of the humerus. These run diagonally. These striations run diagonally. The action this muscle produces is the lateral rotation of the shoulder joint, which rotates the joint away from the midline. The next one we will discuss is called the teres minor. This is the most posterior muscle of the rotator cuff, and its attachment points are the lateral border of the scapula and the greater tubercle of the humerus. Its striations run diagonally. This means that in order for the muscle to contract, the action performed will be lateral rotation of the shoulder joint and adduction of the shoulder joint, which means the arm would be moving closer to the body. The last of the 4 muscles is the subscapularis muscle. We will be viewing this one on an anterior view of the skeleton. Its medial attachment point is the subscapular fossa, which is on the anterior surface of the scapula. Its lateral attachment point is the lesser tubercle of the humerus, which is also seen from the anterior view. This is the only one of these muscles that attaches to the lesser tubercle rather than the greater tubercle of the humerus. The striations run in the same direction as those of the infraspinatus, except it is anterior to the infraspinatus. Sub also means below, as in this is also below the supraspinatus. The action of this muscle is medial rotation of the shoulder joint, which rotates the shoulder towards the midline of the body. So, to review, the 4 muscles that make up the rotator cuffs are the supraspinatus, infraspinatus, teres minor, and subscapularis. They each connect to a certain place on the scapula and to either the greater or lesser tubercle of the humerus. These muscles cause certain actions because of the directions of their striations. Thank you for watching.